All right, good afternoon and welcome to the 31st Bi-Monthly State Breastfeeding Coalition's teleconference, now also presented in webinar format. This is Megan Renner from the United States Breastfeeding Committee, or USBC. USBC hosts these teleconferences in partnership with CDC, and they always occur on the second Tuesdays of even-numbered months at 2 p.m. Eastern Time. So we sometimes lovingly refer to them as the 222 calls, second Tuesdays, even-numbered months at 2 p.m. Today's topic is titled Zooming In on Healthcare, New Call to Action Implementation Tools for Clinical Settings from CDC and the Joint Commission. I will introduce our speakers in just a moment, but first I wanted to go over some logistical details for today. We will display the PowerPoint slides on the webinar screen today as we usually do, but there are also handouts this month. So to access those handouts, or if you are listening by phone only and you would like to view the slides, print them out and view them manually, you'll need to go to the USBC website page. The way to find the teleconference information, first go to www.usbreastfeeding.org. That's our homepage, and once you are there, if you scroll down to the lower right corner, you'll see the quick links box, and in that quick links box there is a link for bi-monthly coalitions teleconferences, and that link will always take you to the info page for these calls. You will find there a PDF of the slides as well as the handouts from CDC for today. There's also a link there to the Joint Commission's Speak Up campaign page. If you have not previously visited that link, you may want to go there and find the materials that our speaker will be talking about. You'll also find there the online evaluation link as well as archives of the past teleconferences. So these calls are recorded each month or each time, and the audio files are posted on those archives pages. It will take usually 3 to 5 days after each call for us to convert those, but you can come back there and listen to all of the archives and download all the handouts and slides from past calls. So that's a handy reference. You may, if other folks in your coalitions are not able to attend at these times, you can please refer them to that page. There's a lot of great information there from past calls. During today's call, all participants will be in listen-only mode, as usual. We do have time at the end for questions and answers, and I will just briefly tell you now how to access the questions box. If you are in your webinar screen and you have your webinar toolbar over on the right side of your screen, there should be a note called questions and a plus sign next to that. If your questions box is not currently expanded, you'll just need to hit the plus sign to open that, and then there's a space where you can type in questions and send them to us. So that's how we do the questions because there's so many folks on the call. And you can feel free to type in questions at any time during the call. Usually we will answer them at the end, but please feel free to type them in at any time. So without further ado, I will introduce our speakers for today. Again, our topic is Zooming In on Healthcare, New Call to Action Implementation Tools for Clinical Settings. And we have Cathy Barry-Ipema from the Joint Commission. She is Chief Communications Officer with the Joint Commission and will be speaking to us today about the Speak Up campaign on breastfeeding. And then we also, from the Centers for Disease Control and Prevention Division of Nutrition, Physical Activity, and Obesity, we will have Daurice Grossniklaus speaking today. She is a health scientist with the division. So I'm going to turn it over to Cathy first. Cathy, please go ahead.
Great. Well, thank you so much, Megan, and welcome everyone. I appreciate the opportunity to speak to everyone today about the Joint Commission Speak Up campaign on breastfeeding. But I'll tell you a little bit first, before we get into that, I'll tell you a little bit more about the Speak Up campaign. If we do the next slide, Megan. All right. So the Joint Commission launched the Speak Up campaign on March 14th of 2002, really to encourage patients to become active, involved, and informed participants in the healthcare team. We wanted patients to see themselves as the Joint Commission being the leader in accrediting healthcare organizations regarding safety and quality. We felt like, what can the patients, what's the role of the patients in the safety and quality equation? And Speak Up is our answer to that, and that basically is we want every patient to see themselves as the center of the healthcare team, not as a mere bystander, someone observing people telling them what to do or what not to do, but also as a key member of the team. To increase patient awareness and involvement on this campaign, we did solicit the Centers for Medicare and Medicaid Services. At the time, it was Tom Scully, and we asked them if they would like to partner with us on the launch of our first campaign, and they gladly did. The campaign, I should make it very clear because I know I'm talking to a lot of healthcare professionals. We make it very clear in all of our campaigns, and I'll talk a little bit more about that later on, but that doctors, healthcare professionals, nurses, and many healthcare technicians and healthcare workers are already working very hard to make healthcare safe. So it's not saying, okay, we're pushing this off to the patients, we're not getting it right on the healthcare side, so we're pushing it off to patients. No, it's saying that together we need to work, and that recognizing that healthcare professionals are very committed to this and into making healthcare as safe as possible, and that patients also have a role. Next slide, please. So we launched this, as I mentioned, in March of 2002, and the campaign basically is, this is the first campaign that came out. It's very general, help prevent errors in your healthcare. It includes on the back panel, it's blank, so organizations can put in their logo or any kind of moniker they'd like to, and then in addition they can put copy in there to talk about their commitment to patient safety and any other information relevant to that particular topic of the campaign. We also make posters available for some of our campaigns as well. And these are all available, downloaded free of charge off of our website, and I'll talk more about that. So can we go to the next slide, please? So to prevent errors in healthcare, patients are urged to, 1, speak up, that's the S, speak up if you have questions or concerns. If you still do not understand, ask again. It's your body and you have the right to know. P is to pay attention to the care you get. Always make sure you're getting the right treatments and medicines by the right healthcare professionals. Don't assume anything. E, educate yourself about your illness. Learn about the medical tests you get in your treatment plan. A, ask a trusted family member or friend to be your advocate, advisor, supporter. K, know that medicines you take and why you take them. Medicine errors are the most common healthcare mistakes. U, use a hospital, clinic, surgery center, or other type of healthcare organization that has been carefully checked out. For example, the Joint Commission is one of those organizations that does go in and visit healthcare organizations to make sure that they are meeting Joint Commission standards. And P, participate in all decisions about your healthcare, about your treatment. You are the center of the healthcare team. Okay. Next, please. So these brochures, the campaigns that we've rolled out, we make sure first and foremost that they're all written at the 5th grade reading level. That's really critical. We've done a lot of work on competency and literacy issues, and this is, it used to be, many years ago, it used to be keep it at the 6th grade level. It is now the 5th grade level. We also make all the brochures and the campaigns that we roll out available in both English and Spanish. We do provide questions to ask and advice about what to expect in healthcare settings. So each of our campaigns really provides very clear questions that patients should be asking and the advice that they should have regarding what they should expect. And then, as I mentioned earlier, that the brochures do have a blank panel, so it does allow healthcare organizations to add their own personal message. They can download. We have the artwork available right up on our website, so you can download it just a PDF, but you can also get the actual artwork that you can hand off to your designers and printers, etc. Okay, next page, please. Now, when we roll out these campaigns, we make the brochures available to all accredited healthcare organizations that we, and they receive this information about every new campaign. So we do a major push out to our 19,000 plus organizations to ask them to please use this information any way they see fit, and we make it as easy as possible. We also say, hey, feel free to use it however you want. If you don't want to use the brochure, you can take the content and pull it into your, your patient admission packets. And I'll talk a little bit later about what some of the organizations have done with the information. But we want people to use it, and we understand each healthcare organization is a little bit different and has its own idiosyncrasies. So we're like, however you want to use the information, you can use the actual brochure, but you certainly can pull it and use it in other vehicles as well. Organizations can also order the brochures. We do provide them at a nominal cost if they choose not to. Like I said, everything is free, and they can give the artwork and everything right to their printer to print off, but we recognize that some organizations have asked us, they're like, we really don't want to send it off to get printed and be bothered with that. Can we order them from you? So we do make the brochures for each of our campaigns available at a nominal cost. We also have Speak Up posters. I mentioned, and there's some of our campaigns have had posters because they've lent themselves to that kind of vehicle. And then we also have Speak Up buttons available. In addition to our accredited healthcare organizations, we make it available. It is on our website. So church groups, advocacy groups, and pharmaceutical companies can also print and distribute the brochures. So anybody who wants to use the material is welcome to do so. And that's basically it. Next slide, please. So some of the campaigns we've released so far, and if you haven't had a chance, I do strongly encourage you to go to our website. You'll see all the campaigns for, the materials for each of our campaigns listed on our website, as well as all the material. But the first one was Help Prevent Errors in Your Care. And then since then, we've released campaigns on help avoid mistakes in your surgery, information for living organ donors, 5 things you can do to prevent infection, help avoid mistakes with your medicines, what you should know about research studies, planning your follow-up care, that has to do with discharge planning, help prevent medical test mistakes, knowing your rights as a patient, understanding your doctors and other caregivers. Next page, please. What you should know about pain management, prevent errors in your child's care, stay well and keep others well. It's a coloring book for children. Tips for your doctor's visit, reducing your risk of falling. This past year, we've released a couple more on specific diseases, one on diabetes, 5 ways to be active in your care while in the hospital, and dialysis, 5 ways to be active in your care while in the hospital there as well. And then our most recent one, which is what we're talking about today, is what you need to know about breastfeeding. Next page, please. So hopefully most of you by now have already seen this Speak Up brochure on this breastfeeding, what you need to know about breastfeeding. Next page, and that's available on our website. The groups that we collaborated with on this campaign, many of our campaigns, when we do start working on them, we do a lot of research with the field and talk to a lot of experts to figure out what are the right topics for us to be focusing on. And once we determine what those topics are, then we work very closely. We identify different organizations that we believe would be beneficial for us to work closely with because they're a lot of the content experts. So obviously the Academy of Breastfeeding Medicine, the American Academy of Pediatrics, Association of Women's Health, Obstetric and Neonatal Nurses, Baby Friendly USA, Centers for Disease Control and Prevention, March of Dimes, and the United States Breastfeeding Committee. And these groups were wonderful to work with. We could not have done it without them. They were instrumental as far as we talked to all these different groups what are the key things that patients need to be aware of before when they first find out they're going to have a baby, or when they're first finding out, and planning, because you can't just all of a sudden make that decision when the moment the baby is born, and then while you're in the hospital, and then after. And so these groups are very, very helpful in providing a lot of input for us. And then we also, after drafting and putting together, we went through several iterations, went back to these different groups for them to run it past people within their organizations to get them to sign off and to felt comfortable. So there's a little give and take going on, but it was I think a very collaborative process, and I think we ended up with a very nice campaign. Next slide, please. So here are some of the key messages about breastfeeding, what moms should know. One of the most important things she will decide, this is all in the material, one of the most important things she will decide is how to feed her baby. Breastfeeding is the best option for most babies. And speak up and ask questions about breastfeeding before the baby is born, while in the hospital, and after going home. Next slide, please. And then how moms can prepare. You can learn about breastfeeding, go online, read books, take a class, talk with other moms who have breastfed, get the support of their partner, check with the hospital to see what support it offers, and ask their doctor about birthing options and how they affect breastfeeding. Next page, please. How moms can talk to caregivers in the hospital, and we encourage them as part of our whole campaign to speak up and tell the nurses and their doctors that they want to breastfeed as soon as possible after delivery. We recognize that, you know, a lot of moms today are, as you all know, because you're very interested in this particular area, that a lot of moms are in the hospital for 24, 48 hours and then they're gone, you know, and they go back home. And especially if it's the first time they've had a baby, we need to say to them, it's okay to ask questions. And to, you know, because it is the first time, and depending on what kind of support they have at home, if maybe they're the first ones to be breastfeeding in their family, they may not have as much as that kind of support. And the nurses and lactation consultants and others that are at the hospital are very, very helpful to them, kind of walking them through what to do, what works best, and just giving little tips. Request skin-to-skin contact immediately. Ask that tests and procedures be performed after the first feeding, and room in with the baby to recognize early feeding cues. Next slide, please. How moms can talk to caregivers in the hospital. Ask that the baby only has breast milk, no formula or water. So we strongly encourage them to make that very clear. Ask that the baby not be given a pacifier bottle, and have a nurse or lactation consultant watch them breastfeed several times before leaving the hospital. Just because, again, as I mentioned earlier, just so someone can give them tips, do this, do that. I know myself personally, I know when I had my my first child, I had never, you know, my family and my sister-in-laws and others who had babies had never breastfed. So I was really kind of, it was very new, but I knew that's what I wanted to do, and this was 27 years ago, 28 years ago, and it was something I really wanted to do, but I didn't have a lot of family support, not that they weren't supportive of me breastfeeding, but they just really weren't able to offer me many tips. I said one of the best things that happened to me is my child, I had her by cesarean section, so I was in the hospital for over a week, and it was wonderful because I had all these nurses from different shifts and people coming in and giving me all these tips. So by the time I left, I felt like I was, you know, felt really pretty comfortable, but obviously most moms don't have that option, especially new moms. Next slide, please. So what moms can do after leaving the hospital. This is important. Spend a lot of time resting and breastfeeding. Stay close to the baby. Call the hospital, and I think it's really important for healthcare organizations to make themselves available to answer questions that moms may have when they go home. A lactation consultant or a support group for advice if problems arise. And keep breastfeeding even when they get sick. Keep breastfeeding even when they get sick. They can safely breastfeed even if they are taking most medicine. So we need to make that point very clear as well to new moms. Next slide, please. So this is just to give you a little bit of an idea. Since we launched this campaign in August, the brochures have been downloaded over 3,500 times by our accredited organizations for use. The Breastfeeding Speak Up posters and brochures are available for purchase on the Joint Commission Resources website as well. So if people, like I said before, if they don't want to download them and print them off, they're certainly available. In addition, as I also mentioned, we make it very clear in all of our communications they can use the material however they would like. Next slide, please. It received a lot of attention in the media. We specifically released it during World Breastfeeding Week. When we were planning this and looking at when the best time was to do it, we thought that made great sense, and we did, and I think it generated quite a bit of good media coverage. And so here's some of the media coverage we received. AHA News, American Academy of Pediatrics, the National Alliance, the Newborn Channel, National Network of Libraries of Medicine, U.S. Breastfeeding Committee, and Triangle Breastfeeding Alliance. Next slide, please. Here's some more pickup that we received from some other organizations, and a lot of web pickup as well. So California Department of Public Health, South Carolina Hospital Association, I think I just lost here. Maryland Breastfeeding Coalition, Healthy Start, Mother Nature, Kelly Mom. So as you can see, just a lot of really good coverage. In addition, since this is just some of the coverage that we received, not all of it, of course, but we also have gotten contact. I think it was the Wellness Network contacted us, and they want to work on a public service announcement with us, so we're working with them on a public service announcement on breastfeeding for their they're a system that contracts with hospitals, so to get these messages out to you moms. So we're excited about that. So we see this, you know, it's a kind of an evergreen story, so it's not one of those things that's like one time you're announced and it's done. So we know that we'll probably get a lot more coverage as time goes on. Next slide, please. Next, yeah. The other thing I wanted to mention is the Joint Commission. One of the things we've heard from our customers is they really like the Speak Up videos, and I'll talk a little bit about some of the statistics and research we've done on our Speak Up program. But they really like the Speak Up brochures, and we've really tapped into topics. I think I mentioned earlier that we've asked them, what are you interested in? What do you want to hear more about? And so we've really tapped into those experts, or to our healthcare organizations, to ask them. One of the things that we have heard from them is we would love videos. Can we do videos? Because obviously not everybody reads, and you know, reading is becoming more and more one video. So we began releasing a series of animated Speak Up videos this year in 2011 to encourage patients to speak up and be active participants in their health care. We have, there's 60-second animated videos. They air on the Joint Commission's YouTube channel. I think we've had over 26,000 downloads in just the first 6 months. They're on the Joint Commission website and in other venues. We do allow our accredited organizations to download the videos free of charge, and they're available in both English and Spanish for use on their closed-circuit televisions and other uses, and we also make the transcripts available. And the cast of characters encounter everyday situations where they have to read instructions, inspect labels, and speak up to ask questions, you know, of their caregivers and their physicians. We've been, in addition to having it on YouTube, we've had organizations download them on off of a site, off of our website, where they can download the actual videos. So we've gotten quite a bit, and you can watch it on our website. So when you go to our website to look at the Speak Up material, you can also look at the 6 videos we've done. And we would like to, if we get the funding, we would like to do one on breastfeeding. Next slide, please. So the first 6 videos were, I've got the dates when they were released, but Prevent Errors in Your Care. One, and it really is, I strongly encourage you to watch them. Very cute characters that are very engaging. They kind of, these characters have just kind of, like I said before, they are part of everyday situations that they ask questions. And so the first one, Prevent Errors in Your Care, it starts with a young mom goes to pick up a cake at the bakery and is ready to walk and looks at it and says, wait a minute, my son's name is not, you know, Becky, and he does not like ballerinas or whatever. And then the next one, this gentleman is at a French restaurant with his girlfriend and is ordering soup de poisson and wants to look like he knows what it's going to be. Then he thinks, oh, I better ask a question. What exactly is that? And they say, oh, that's fish head soup. And then another little vignette is someone goes to pick, this really big Harley guy goes to pick up his car from the valet, and they hand him this little pink, they pull up in this little pink Volkswagen, and he goes, that's not my car. And so in all these everyday situations, everyone speaks up. And then it goes back, so why not in your health care? You know, every day there's situations in health care, and we should feel just as comfortable as speaking up as if we were at the bakery, if we're at the restaurant, or picking up your car. Prevent the spread of infection is another one that was done. Take medication safely at the doctor's office. Kid Power, that's Captain Speak Up. It's very cute. And then the most recent one released was Reduce the Risk of Falling. So those are the 6 that we've done this year. Our plan is to do hopefully a few next year. So we'll see. Like I said, one of the ones we would like to do is one on breastfeeding, which is, it's a funding issue right now, but we think we probably will be able to get it. Next one, please. Thank you. So the Speak Up, we've surveyed our customers a couple of times, our accredited healthcare organizations, and as I mentioned, it's about 19,000, 80% of the hospitals in the country, as well as ambulatory, home care, long-term care, behavioral health, labs. We also certify disease-specific care programs. And we have had quite a bit of, like I said, our organizations really like it. The Joint Commission is a little bit of a different situation, I think, than a lot of organizations because we are actually in healthcare organizations, 80% of the hospitals, once every 3 years at least, to evaluate them. And so we are a great resource for them to get information like this. When we've asked them what you thought about this Speak Up program, 85% reported that campaigns like Speak Up bring value to accreditation certification. They're looking for this kind of information when dealing with quality and safety issues. Over 80% rate the Speak Up program is excellent or good. Over 60% would use a Speak Up video series if it was available, and so therefore that is why we did begin the Speak Up video series. 75% reported they have reproduced or downloaded the brochures or posters, which is a pretty impressive number, and they're using it in one way or another. And then more than 67% have used Speak Up information advertisements or billboards. More than 60% have also reprinted information in the Speak Up brochures and their patient handbooks and education materials. Next slide, please. They're also very creative. Healthcare organizations are very creative using information. The pamphlets are included in staff orientation. They put them in patient admission packets, patient education materials, and they distribute them at health fairs and education fairs and public information booths. They also have hung posters in the public areas and patient rooms and waiting rooms. I know I was in a hospital visiting a friend, and they literally had the Speak Up brochures laminated and hanging off each of the trays of the patient's trays, which was great. Staff wearing the Speak Up buttons, basically saying, hey, it's okay to speak up. It's kind of like, what is that Speak Up? Well, if you have any questions, it's a great entree to say to the patient, feel free to speak up if you have any questions. Public service announcements, organizations have used them as PSAs and closed-circuit television patient education programs. We also have worked very closely with, can you go to the next slide, please? We also have, the next slide, please. Okay, perfect. Thank you. I should mention here that we've worked very closely with the Get Well Network, with Accent Healthcare, LodgeNet Healthcare. We also have been working with division of Accent Health, which also goes to physician offices. We've worked with them. They've 12,000 physician offices. They've run the material there. So we're working with a lot of systems that have contracts with healthcare organizations to run on like their little patient education television programs. So they're running the Speak Up videos on those as well. We also, organizations have sent press releases to their local, television, radio networks, community newspapers and magazines saying that they are, engaged in encouraging their patients to speak up. Information including newsletters to healthcare organizations, staff, and the public. And then plaques created with Speak Up information, Speak Up campaigns held. They've used it as a kickoff for Hospital Week. In some organizations, they've established a Speak Up task force, like what can we do to encourage our patients to speak up. So, and then the final slide. And here's more information that people can get, information from the Joint Commission site, Joint Commission resources if they want to purchase the materials for a nominal fee. Also, we post the videos and materials on the Joint Commission International site. I mentioned that we have them in Spanish, but we've also gotten contacts from Brazil, calls from Brazil and Australia and Canada and all over the world asking us to if they can take the material and have it translated for their particular country. And then, as I mentioned earlier, we've also on YouTube. So those are the highlights of our Speak Up program, and I will be more than happy to answer any questions, I think, after the next speaker has completed. Thank you.
Wonderful. Thank you, Kathy. This is Megan again. I have had a couple of questions noting that my sound might be going in and out on my line. So while Daurice is speaking, I'm going to switch to a different line. I apologize about that. It's just going to take me just a moment to switch to Daurice's presentation. And I do have one question that was asked, Kathy, that you might address while I'm doing that. Hello?
Sure.
Oh, there you are.
More than happy to.
Wonderful.
Yeah.
Sorry. And the question was about the translation and about other languages. I don't know if you want to just talk a little bit more about how that works.
Sure. We have, as I mentioned, we have translated our brochures and material, our videos. They are in Spanish as well as English. But we recognize, obviously, that there are some countries, especially Joint Commission International, if they would like to translate. So we have given them the copy, and they then have it translated for their purposes in their country. So we don't translate it for them, but we do, and also too for the video, the Speak Up videos, because the nice thing about animation is you can put it in different languages, and so that's where we can provide the video, and the copy, and so then you can have it translated for your purposes. I think that answer the question.
Yeah, that's wonderful. Thank you. All right, so I think everyone can see sure. Daurice's presentation now, and so I'm going to go ahead and turn it over to Daurice with the CDC. Daurice, you might be muted. We don't hear you yet. Daurice, are you there?
Okay, can you hear me now, Megan?
There you are, thank you.
Hello?
Yep, we can hear you.
Okay, good afternoon. I'm Daurice Grossniklaus. I'm a health scientist at CDC, and I'm going to be sharing with you today the new call to action implementation tools for clinical settings that we have been working on here at our office. These came about as a result of our ongoing work related to the Surgeon General's call to action. After the launch, we identified a need to inform and really spread the word about the kinds of specific actions various actors could take in order to help support mothers to breastfeed. Next slide, please. And the purpose was to reach out with targeted information for specific audience groups and to focus their attention and efforts on the actions and implementation strategies that most directly relate to their particular role in supporting mothers to breastfeed. Next. So as many of you are aware, next slide please. Much of our work at CDC has focused on maternity practice in infant nutrition, and so we began by addressing the need for implementation tools that are targeted to the clinical setting. And so that was the starting point for developing these tools. We now have available, and they just went live to the internet today, implementation tools which we're calling action guides, and they are specific to doctors, nurses, and healthcare leaders. And you can see on this slide the front panel of the Doctors in Action guide. Next slide, please. Next. Thank you. This is the front panel of the Nurses in Action guide.
Welcome to GoToWebinar, Web Events Made Easy.
Look and feel between each of the action guides. So you will notice that all three have a similar layout. They have similar titles, headings, and subs available from the project. And we also wrote them using simple language so they can be conveyed an easy-to-read message. We wanted busy clinicians and hospital administrators to be able to pick these up, quickly read these, and understand what the Surgeon General is asking them to do. You'll notice at the top of each action guide is a statement about the importance of breastfeeding and the need for support from multiple actors. Below this, we have identified what it is, and for this particular instance, it's nurses in action. So actions nurses can take to help patients breastfeed. And then under each of these kind of short headings, we've included a description or a brief description that's relevant to that heading. And you'll see that on the right-hand side of the page, there is a blue call-out box, and we've included some motivational statements to encourage the actors to respond to the Surgeon General's call. Next slide, please. And this is the back of the Nurses in Action guide. And again, these actions and implementation strategies were pulled directly from the call to action, and we've reflected that in the title. so that when nurses read this, they will know what actions and implementation strategies the Surgeon General has identified for them to take. Next slide. Could you please go back one? Thanks. This is the back of the Healthcare Leadership Action Guide, and you can see that we have tailored the actions and implementation strategies to healthcare leaders so that when they read this, they'll know what the Surgeon General wants them to do and how to go about implementing those actions. Next slide. We hope that you can help us spread the word and disseminate these action guides. We anticipate that we'll have print copies available probably through CDC information or info. We are currently in the process of obtaining the necessary clearances for this, and we will keep you informed about when they do become available. We also are hoping that you will be able to push these out and distribute them electronically via your partnerships and electronic newsletters. And we also have made them available online, and they just went live, as I mentioned earlier, today. And I'm going to show you how you'll be able to find them on our website. Next slide, please. In terms of accessing these online from the CDC website, there is a link from the breastfeeding homepage. You can see towards the center of the screen the red arrow, which shows you where the colorful icon, the new icon is. And if you click on the words Action Guide for Healthcare Settings, that will take you to the call to action page. Next slide. And when you land on this call to action page, you'll see that there is a list which allows you to access each of the 3 individual guides. They're also going to be posted, or they're also posted on the healthcare page, and you can access the healthcare page by using the left navigational menu. So if you click on the 3rd box in the call to action section, it's labeled healthcare. That will take you to the healthcare page, which is on the next slide. And you can see again that the action guides are going to be available. Each of those 3 individually are available from that link. We also just sent Megan the link for the actual PDF, and she will be posting those on the USBC website as well. There are a small group of us at CDC who are working on these action guides. They include people from the nutrition branch as well as from our breastfeeding work group. So those are people from across our division. And we're currently developing action guides for employers, researchers, communities, and public health professionals. Our goal is to have these finished relatively soon. I've been told not to say a date, but we're hoping by the end of the year and hopefully impressed by early next year. But this is going to depend in part on how long it takes us to get through the necessary clearances. And the next slide. We just would like to thank you for your attention and interest in our new implementation tools. And if you have any questions, we'll try to answer those for you. Thank you.
Thank you, Daurice. Can you hear me okay?
Yes.
Okay, great. This is Megan again, and I'm just going to remind folks how you can ask questions. I do see we have a slew of them already, but if you have not yet asked a question and you would like to, in your webinar screen in your toolbar, there should be the word questions, and if there is a plus sign next to that, if you have not already expanded it, just click the plus sign, and that will open up the box where you can type in your question. So please feel free to continue to ask questions. I'm going to try to read them to our speakers as efficiently as we can here. So let's see. We have, thanks for adding breastfeeding to your list of campaigns. We did already talk about the other languages. So we have a question from Karen Peters. The literacy level of the brochure, I guess this is about the Speak Up. Is this about the Speak Up brochure?
Yes.
Is very high. And is there a plan to compose a brochure that supports mothers who have the need for a lower literacy level? I know you talked a little bit about the reading level.
Right.
Kathy?
We are at 5th grade. The research we have done for literacy has said that you should keep it at 5th grade level, and all of our brochures are at 5th grade level. Some may be 5.2, 5.3, some may even be as high as 5.7, 5.8. I will tell you that even when we worked on the breastfeeding one, I don't want to mention, but one of our partners had done some heavy editing and ended up getting it to, I think, at 7th or 8th grade level, which then we had to go back and nicely say, thank you, great information, but way too high. So we really do keep it at 5th grade level. It's hard to do it. The only way, I think, in some cases, and that's why we think the video is helpful, whenever we can do that, the more we can get funding to do those, I think it's helpful, is because the videos are another way. More and more you read them on research. The research you do on literacy is to do more pictures. So that would be one thing that probably we could do with some of our brochures. We did do it with our infection control brochure. There's a few that we do have illustrations, and we think that is very helpful as well. The issue is, though, is because of the size and the format, it's hard to get the information you're trying to, in addition to doing illustrations. So that's where we kind of get into, it's a little difficult at times. But our plan is not to go below 5th grade level. I think, if anything, is that when we can, we do try to use some illustrations.
Okay. This is just a comment. Says, these materials from the CDC and the Joint Commission are wonderful. I can see myself printing them out and using them this very week at my institution. And I did just want to comment on that we will, right after this call on the USBC Facebook page, we will post that new link that Daurice was referring to for the action guides. So I know many coalitions, many state coalitions are connected to our Facebook page. That might be an easy way if you'd like to hit the easy share button and share with your groups. We'll set that up so that you can do that right after the call.
Okay.
We have a question for the CDC call to action guides. Will there be PowerPoint presentations created in addition to the PDF? Daurice, are you still there?
That's a very good question, and I don't have the answer to that, but we can certainly take that back as a suggestion and see what kind of feedback we get about that. So we'll follow up on that from this end. Thank you for the suggestion.
Okay. We have a question about the hospital in our area isn't interested in the Joint Commission core measure. Can you suggest any motivation strategies to reach this facility?
Well, I mean, we do have, as I think many of you do know, we do have in our set of perinatal care core measure set, we have one on elective delivery, one on cesarean section, antenatal steroids, healthcare-associated bloodstream infections in newborns, and PCO5, exclusive breast milk feeding. We're hoping, I mean, with our accountability measures, we're hoping to, as we ramp up and increase, I think many of you may be aware that we just released for the first time a couple weeks ago our top performers, and some of your hospitals may have been top performers on key quality measures. Our plan is to increase the number of measures that organizations will be participating. So maybe they aren't now, but hopefully maybe in the future as they add more in, they may be able to. It's a tough one. I mean, I think most of you know, because this is really, for those of you who are not aware of this particular quality measure, it's exclusive breast milk feeding. That's the name of the measure. Description, exclusive breast milk feeding during the newborn's entire hospitalization. And the rationale is, and it's on our website, so you may want to check that out. But organizations can pick, but as we ramp up and increase the number, maybe eventually that hospital will be participating. So, okay.
Yeah, and we have had, just so you're aware, Kathy, we have had at least one webinar, probably multiples in the past, where we have talked about the core measure. So
okay,
I know many folks are very excited that it is now out there, and I know many of us are also struggling with encouraging hospitals to use it. So that's
right.
An ongoing discussion with,
I'm
with
sure.
all of us.
I'm sure.
So. This is a question, I'm not sure for which speaker it's for. If you guys, when you're asking questions, can specify, so I'm going to assume this is for both of you. Will this information be made available to hospitals directly, and will they be encouraged to engage in their use? So I know we talked a little bit, Kathy, about how that goes out to your accredited institutions.
Right. And we do strongly encourage them to use it. As I mentioned, the statistics and the research that we've done, a good proportion do use it. We can't require them to use it, but we can strongly encourage them to use it. And I think most organizations are using the material in one way or another, but it's not something we can require. But we do push it out in many different ways. We push out through our Facebook, through Twitter, we have a weekly newsletter that goes out to all our accredited organizations that we pushed it out, and we did press releases, social media releases, video on it, and as well as our perspectives, our publication that goes to all our accredited organizations. So we really did push out in many different venues and use many communication vehicles, but we can't require them to use it. I think that may answer the question.
Yeah. Daurice, do you want to talk about the same? The question was, will the information be made available to hospitals directly to encourage their use?
I think that our hope is that as state coalitions and state public health practitioners meet with hospitals and through their own partnerships, we'll be able to push out the information. At this point, I think that's our primary hope. I know that we're going to continue to work on our dissemination plan, so we may be doing that more directly down the road. But I think our hope is that through these different partnerships, some of the people in the coalition can help push out the information to the hospitals.
Yeah, and that this is a related question. Is it okay to start disseminating the action guides immediately? They can't wait to share, and I assume the answer is yes.
I think it's okay. I think we just have to get the print clearance. So I think small numbers of them, if you were printing a huge volume, probably not. But I think small numbers you can. And also, it's certainly fine to send people the PDF, the link to the PDF as well.
Okay.
And actually, Jessica just clarified that people in the coalitions can print as many as you want. So it's we're the ones who have the limit on how many we can print at this point in time. So yes, you can go ahead and start to distribute those. And please make them available electronically if you can. We appreciate your moving them out and spreading the word and helping us with this. So thank you.
Okay. Let's see. We have several questions that are ones I know we've talked about quite a bit on these calls about the answer to the question about the Joint Commission core measure. It is not mandatory. The perinatal core measure is optional. I want to make sure folks understand that Kathy is a communications person within Joint Commission, so she may not be the one to be answering questions specifically about how those core measures work and how that might that optional mandatory thing works. But I don't know, Kathy, if you want to talk about that at all, or
well, a little bit. I mean, that's not my area of expertise. But the core measures, we have accountability measures. We've got core measures. Organizations have to choose. There's heart failure measures. There's pneumonia measures. There's different measures and organizations have to choose a certain number to participate, to be accredited. And so to a certain point, this is a voluntary measure. It's an NQF endorsed voluntary consensus standard for hospital care, and so organizations can choose whether or not they want to use this particular measure. However, and I would need to just verify, but as we ramp up and there's more measures that organizations will be required to report on, that we may see an increase in the number of organizations who choose this measure for their purposes, for measurement and for to participate in the ORIX program.
Okay. And it is something that we're always looking at it at USBC as well. But at the moment, for folks that are not familiar with it, it is voluntary, as Cathy said. This is a question: how can I find out who is the TJC, that's short for the Joint Commission contact person for our state? Is there a state?
Not really.
Representative?
I mean, for the Joint Commission, not really.
Yeah.
For the state, I guess. Just so we're really clear, we accredit healthcare organizations, and so we, hospitals, as I mentioned, hospitals, home care, behavioral health, long-term care, and we have account execs for those different programs. But we send surveyors all around the country to go into healthcare organizations to survey them. We don't have a state-by-state rep. I'm not sure if I'm understanding the question right, but we don't have state offices. We're located in a suburb of Chicago, in the Chicagoland area, and we have about 500 surveyors that go around the country to evaluate healthcare organizations, and our central office is here. So we don't have a state representative, and I'm not sure if there's so I think that may answer the question. No, there's not a state representative. If there's somebody specific that they're looking to talk to someone about, maybe if that person can be a little clearer about what they're looking for, maybe I could put them in touch with the correct person. Okay, sure.
This is a question, Daurice, about the Nurses in Action guide, and wondering about whether it might include something about avoiding being an advertiser or marketer for formula companies, and just a little bit of explanation. They're talking about how formula reps still come onto the maternity floors, and they get they give perks and food and other stuff to the nurses, pens and clips for their hospital badges and gift bags and all that stuff. That is, for all intents and purposes, is advertising and marketing for the formula companies. And so they're just talking about nurses needing to realize that they are marketing for a company when they're doing this, and the conflict of interest involved. Is that something that might become a part of the Nurses in Action guide, or can you speak to that?
I guess I could say, if we get a lot of feedback that that's something that's missing and we should include, we might need to go back and re-look at these. But when we decided to, actually in the call, they refer to clinicians, and we decided to kind of split up doctors and nurses, and we gave more different tailored information to doctors from nurses. And we felt in some ways this issue was better served on the doctors' call to action, so it is on the doctor's call to action. We realize that this is a problem and an issue, and we didn't include it on the nurses. We felt that they had other rules that were important, because the policies and that kind of thing at the hospital have to allow or prohibit this kind of serving as advertisers. So again, we could potentially look at that down the road. We did intentionally put it on the doctors and not include it on the nurses, but if we get an influx of concern about that, then we might have to go back and re-look at them. And I guess that's all I can say about that, really, at this point.
All right. Well, we are getting close to the end of our time. I did want to thank our speakers, Cathy and Daurice, for presenting today. This was wonderful and informative information, and we do encourage coalitions to share all of these links and wonderful materials, both with their coalitions and also with hospitals and healthcare providers that are in their networks. I do have just a couple of announcements from USBC before we move on to regional calls. First of all, I know we have announced the date a few times, but to reiterate, the 4th National Coalitions Conference will be held next August. That's going to be August 4th through 6th of 2012. We will be back in Arlington, Virginia, although at a new hotel. We have outgrown the hotel we have been at the last couple of years, so we'll be at a new hotel. This information is posted on our homepage in the news box. So if you're listening to this and you're scrambling to write down the date, do not be afraid. You can go to our homepage, and there's a Save the Date link right in the middle in the news box. And that will take you to the page with the date and the location, and all the other information coming out in the future will be posted on that page as well. So be sure to bookmark it. We are, of course, thrilled to convene the 4th iteration of this conference. We do expect to be focusing on the implementation of the call to action, so stay tuned for theme, and abstract information will be coming out in the next few weeks as well. So please watch for that and start to think about in your coalitions. I know many of you might be meeting today, so you may want to start thinking about what your state or territory coalition might want to present. We will again have oral, breakout presentations orally, as well as breakfast table topics and poster presentations. So all of those formats, as in the past. With the registration and sponsored attendee funding, I did want to announce today good news that the CDC grant that we typically have received for the 2 sponsored attendees from each state coalition, state territory, or tribal coalition, that has been renewed. So we are anticipating the same sponsored attendee funding, similar process for that as we have had for the past conferences. So that covers the 2 sponsored attendees from each coalition. That is a separate bucket of funding, however, from the funding for the WIC breastfeeding coordinator. So I do want to let folks know that the WIC state breastfeeding coordinator funding is pending. We are hoping to and anticipating to have that similar funding, but it is not final yet. So folks are aware, the 2 representatives per state funded by the CDC is approved. It's final. It's there. But the USDA WIC breastfeeding coordinator funding, we will announce as soon as we know that for certain. So also stay tuned for that. And just a quick note about the dates. I know this is a question that I get quite a lot, and I know several folks have asked about why have we moved it to August. And I do want to remind folks that we did just this past August declare that August henceforth is National Breastfeeding Month. So I know this is something that a lot of states have already done in their state legislatures. They've had resolutions and declared in Texas or in Illinois that the whole month of August is for celebrating breastfeeding and breastfeeding awareness. So if that's something that you're interested in doing at the state level and you have not done that in the past, do feel free to get in touch with us. We have a number of examples of state resolutions that we collected while we were preparing to do the national. But now that it is national, that does allow us to kick off the month with larger events in DC at the conference. So we're looking forward to that. And then also allowing plenty of opportunity for all of the state coalitions and local coalitions to host events throughout the rest of the month of August in your home state. So, so do think about that. Perhaps it's not too early to think about next August and what we might do with a larger time frame of the whole month. So those are just a few highlights about the conference. We will be blasting out a Save the Date email. So for those who may not be on the call today, they will get that, and feel free to forward that far and wide. That should be coming up this afternoon as well. So without further ado, I do just have one other quick announcement in that we do have a vacancy in the Southeast region. I know that not everyone goes on to the regional call, so I just wanted to note this. If you are in the Southeast region, our alternate regional rep, Debbie Albert, has actually moved out of the region. So that means that we will have a special election coming up in the Southeast region to fill that alternate regional rep slot. So do watch for that. If you're in Southeast, you'll be seeing the emails about the nomination process for that special election. So, without further ado, then I will sign off. And if you are going on to the regional call, you will need to disconnect from this call and dial into the separate regional number. So thank you, everyone. Thank you, Daurice and Cathy, very much. And we will talk with you in December. Have a great afternoon.
Thank you.